This question deals with a 35-year-old woman comes to the physician because of 2-month history of headaches and a milky discharge from her breast. Physical exam shows expressible galactorrhea bilaterally. Her serum prolactin concentration is markedly increased. An MRI of the brain shows a 2 cm mass in the pituitary gland. Which of the following pharmacotherapies is most likely to improve this patient's symptoms? Now, this is a typical case of prolactinoma. The patient has headache, 2-month history of headache, milky discharge from the breasts, which galactorrhea caused by prolactinoma. Physical exam shows expressible galactorrhea bilaterally, which I just mentioned. Her serum prolactin concentration is markedly increased. MRI of the brain shows a 2 cm mass in the pituitary gland. Now, which of the following pharmacotherapies is most likely to improve this patient's symptoms? Now, the number one factor which decreases level of prolactin is going to be dopamine. Okay, dopamine is going to inhibit prolactin. You can find this information on page 485, first aid 2012. Another other two interesting points that I want to mention here is that TRH is going to stimulate TSH, obviously, and also prolactin. This is the one I tend to forget often. Okay, and prolactin is going to inhibit GnRH. Just a little tidbit about prolactin since we're talking about prolactin. So now we know from this question that dopamine is going to be inhibiting prolactin. So if we give a dopamine agonist, then we can inhibit prolactin, right? And which of the following is a dopamine agonist? Bromocriptine. That is our dopamine agonist. Now, prolactin is made by the lactotroph cells of the anterior pituitary. Okay, and in the absence of dopamine, prolactin is made uninhibited, which really raises the level of prolactin. This is why sometimes dopamine is even called prolactin inhibiting hormone. Okay, so anyways, going back to the question, here the other options are quite irrelevant because the single fact that dopamine inhibits prolactin is enough to answer this question, bringing us to choice A, bromocriptine.